Mike Brandoni from Insurance Network America. We're here this morning because you all had an interest in our webinar, The Class Act, Your Opportunity to Shine. We're going to spend probably the better part of 35 to 40 minutes, possibly up to 50 minutes, discussing some of the opportunities that are available to you around this act as part of the Healthcare Act of 2010. We still have some attendees coming in, so I'm going to take a couple of seconds to just kind of do a quick little cleanup here for everybody. You should all have a panel on the side of your screen that shows your attendance and a chat box. If you see a little orange arrow and if it's pointed to the right, your Windows box is open. If it's pointed to the left, click on it. That will open up your Windows box, and you'll see down about approximately 3/4 of the way down, you'll see a box for chat. If you do have any questions, because this is in a listen-only mode, type in your questions there, and I will be able to grab those questions as they come in, and I will repeat them to the entire group, and hopefully I'll be able to answer those most effectively. So that's our only cleanup item for this. We are recording this, and we will put this up on our website with the slides approximately tomorrow. So if anybody wants to do a follow-up, they can. And for some of the individuals who unfortunately missed this, it will be available to them as well. Congratulations to everybody for taking the first step on looking at not only the Class Act but long-term care. Today we're covering the Class Act exclusively, and much has been written about this benefit, which was added to the 2010 healthcare law, as I stated earlier. As it stands today, there are conflicting reports as to whether this act will ever see implementation. The conflict really is the cost and the determination of the federal government, again, getting involved in being an insurance company, quasi-insurance company. Members of the Obama administration, if you've seen or read anything about it, have called this program a recipe for disaster from the standpoint of there's no way they can actuarially determine the benefits and the value and the premium at this point. Yet others in the GAO have projected the program will generate over $70 billion of revenue over the first 5 years of the program. So as you can see, it's a political hot potato. Anything that generates $70 billion in revenue, which you and I would call premium, and which would be your backstop to pay benefits, well, the government's going to take a look at that money. And I think you know, when we look at Social Security, Medicare, Medicaid, how that has worked out and how that is under a lot of stress and under a lot of pressure today. But for the purpose of today's call, we want to have a discussion on the Act and how it helps you position long-term care discussions with your personal and business clients. And a couple of points before we get into the actual slides. 2/3 of all agents will be asked about the Class Act before the end of the year. Now, this information is coming directly from a Genworth study that was done in the beginning of this year. Over 350,000 new individuals will purchase long-term care by the end of 2012, and there will be 8,000 insurance agents writing their first long-term care case within the next 12 months, and all of that is based on historical data over the last 5 years. So as you can see, the market is huge, has a huge upside potential. And given the fact that our Americans are living longer and they're running into these problems, this healthcare market is a burgeoning market. Long-term care is a burgeoning market for individuals. So oops, let me back up. Okay, bear with me, guys. Okay, so the Class Act itself. Summary of the Class Act. It's called the Community Living Assistance Service and Support Act, and it's Title 8 of the Healthcare Reform Bill. It was created as a voluntary government-run long-term care program. Remember, voluntary is the key here, and it is effective January 1, 2011. However, nothing has happened, and the plan was not to implement until October 1 of 2012, and right now, nothing has been built. So premiums haven't been decided, benefits haven't been decided, just the shell and the framework is put into place at this point. Eligibility for this plan. Now, if you think of this plan as a government plan, the eligibility is that any working American 18 years or older will be eligible. Very, very similar to some of the other social programs that are in play. Is once you're starting to receive a salary, you're paying into a system. Now, but the only difference here is that this is voluntary, so you have to be real careful when it comes to that. The actively at work requirement is anticipated to have a low income threshold based on Social Security. So again, this is going to probably be it's not going to be for the business owner per se, but the business owner can participate in this program as well as anybody else. The interesting at work scenario, the requirement is you have to pay into the program for 5 years, and we'll take a look at that a little bit later on. But you only have to be at work 3 of those 5 years to generate a benefit. So you can pay in for 36 months, but receive benefits at the end of 5 years. An interesting concept on the way they want to create this program. Claim eligibility right now has not been determined, but it will be determined by the Department of Health and Human Services. But it will be similar to any tax-qualified long-term care insurance program. The benefits of the program will provide probably a benefit amount of at least $50 per day per cash per participant who fail 2 of the 6 activities of daily living or have cognitive impairment. Now, if anybody on the call is currently selling long-term care insurance, whether it be in a multi-life scenario or a group scenario, in a multi-life scenario, it's generally a group of individual policies built onto a list bill, and group is what we all know as the traditional group model. Multi-life is usually anywhere from 2 to 15 to 20 individuals. Group gets to about 20 to 25 and above. So that's the differentiator between multi-life and group. But here, under the government's plan, they're saying $50 a day. Well, if you take $50 a day, you know that if you look at healthcare costs around the country, nursing home, anywhere from $5,000 to $6,000 to $7,000 a month. $50 a month doesn't really do much other than cover up a very small percentage of those costs long term. The benefit, though, will last for an unlimited period of time, and here's where the government's plan differentiates from the marketplace in general. This is a lifetime benefit plan where, if you've looked at it recently, most plans now are being sold at the 2 to 5 year range, because if anybody, the historical and the statistics around long-term care confinement is that if anybody participates or goes into a long-term care facility, their stay there is generally no longer anywhere between 2 and 5 years. The 2-year period is shorter. Some people actually roll out and go back home, but for the most part, if you're in that environment, 5 years out probably will end up in death. Here, the government's saying that you have a lifetime benefit. And if you start at 18 and if something happens to you at age 30, you could go for the next 60 years, have the government paying $50 a day, because they have not figured out how the benefits will last, and there's nothing set in stone for this program. It's also anticipated that the benefits will increase with disability. So if the worse you are, the more money you get, which is an interesting concept. So if you have 3 of the 6 ADLs, or 4, or 5, or all 6, you could conceivably receive a higher benefit. Sadly, though, if you have loss of 6 of the ADLs, you probably don't know who you are, where you are, so the money is kind of irrelevant and somebody else is taking care of it for you. When you look at private coverage, there's so much more flexibility, and I think these are some of the things that, as you talk to your groups and as you talk to individuals, you want to be able to talk to them about the concept of, here's a program that would be payroll deducted, and here's the pros and here's the cons, which we'll talk about later, versus something that you own and you can build and create for yourself, and you can take it with you. It's portable, and it has a lot more benefits and features. The waiting period. Now, this is one that to me, this is a real detriment when you take a look at this, at the potentiality of this plan being put in place from a government perspective. You really have a 60-month waiting period. You have to pay into the system for 5 years before you can get anything. So basically, it creates a vesting period. And since the plan may not be available until 2013. You're really talking until 2018 before you could receive any benefit. So in a voluntary plan of employees from 18 to however old you are, if you are 65 years old today, you have to work for at least another 3 years and pay in for 5 years before you can access a minimum benefit of $50 per day. Right then and there, that is a key beneficial opportunity for you to have that discussion around what we call multi-life and individual policies. Each individual employee can build a policy that they want with the benefit that they want, with the elimination period that they want, with the pricing that they want. And if the employer allows for it to be payroll deducted, it is a portable individual program that gives them the flexibility to do what they want when they want to do it. That is the key differentiator between this plan, excuse me, between this plan and the government and individual long-term care. The premiums will be determined by the Secretary of Health and Human Services, and again, those have not been determined yet at this point. But it's based on a 75-year solvency requirement. And again, I don't know how the government's going to come up and figure out a way to create a 75-year solvency plan without knowing the number of individuals. And because it's a voluntary plan, anybody who is sick or disabled currently can enter into the plan because there is no pre-existing condition on this plan itself. That's a real big differentiator. So with any type of government plan, if you're already sick, you can get in. So I think you can see as insurance professionals, if you have a voluntary plan and that voluntary plan has no pre-existing condition, you can start at 18 and go right up until the last day of your employment, you're probably going to have a very risk-sensitive pool of individuals who are probably going to lean heavily on the benefits, and you won't get the healthy people to come in and utilize the service, which is going to be, as we said earlier, where the Obama administration individuals had said a recipe for disaster. Just think about that. If you were building an insurance product where anybody could enter, regardless of their health, and you paid a minimum premium for that, but you paid out a maximum benefit, how long would you be in business? Well, the answer is you wouldn't. And the fear here is that the federal government would not only increase the premiums, because there is no contract. It's not an insurance contract. They not only would increase the premiums, but they would reduce the benefit, or they would find another way to supplement the depleting asset payment of the benefits. Those are all things that you need that when you talk to your employer groups, you need to look at from the standpoint of how is this product going to be positioned? Is it valuable? Does it give the employer any benefits or the employee any benefits? And is there something that they can do individually that can be more flexible, better price designed, better benefit, and a longer-term solution for that individual? The underwriting of the plan, well, as I said before, it's guaranteed issue program. So there's no underwriting except for the activity at work requirement, which is 3 of the first 5 years. So again, here you have adverse selection coming into play with this, which and because you don't have a contract, the premiums for this $50 a day could spiral out of control very, very quickly after the 6th year. So some of the pros and some of the cons of this is the greatest pro that we see in the marketplace here at Insurance Network and for our agents at large is that the Act is the most visible program to date that brings a long-term care discussion to the country. It brings this discussion to the workplace as it creates a discussion and debate to the value of long-term care for all Americans. You know, and I will tell everybody here, we've been in the long-term care business a long time, and what we've seen is the fact that the easiest sale for long-term care is to the individual who's a caregiver or knows somebody who has given care to somebody who is elderly and infirmed. Individuals who have not gone through that process generally don't see themselves as being sick or infirmed. But with medical science as it is, individuals are living longer, and the percentages of those individuals who are going to need care sometime in their life continues to increase exponentially as medical science improves our healthcare and our experience in life. The other con to this thing is that anybody, or the other pro, I'm sorry, is that everybody 18 or older can participate in this program. So it does attempt to bring in younger individuals who could conceivably play in for a longer period of time to try to keep the program solvent. The cons for this program, though, is that everyone is eligible, guaranteed issue, it's a government-run program, premiums are unknown, actuarial estimate premiums may be higher than private long-term care programs due to the guaranteed issue. Premiums must be paid for 60 months before being able to access benefits, therefore creating a vesting period for the plan. The entire plan must be self-sustaining through voluntary employee enrollment. Now, that's a key, voluntary employee enrollment. So somewhere along the lines, the employer is going to have to create a payroll-deducted format through the federal government. Very, very different than Social Security or Medicare at this point, because it is voluntary. It's not a requirement. So there's going to be an onus on the employer to identify some of these employees and right now keep track of who's in and who's out. There's no contract, so the plan is based on the promise of the federal government, and the Health and Human Services Department determines the claim process. As you can see, there's an awful lot of gray area here that makes this plan an interesting plan, but at the end of the day, does it really meet the needs of your employer groups and your individuals? The value, and the value here in this program as we see it is that is to Americans is that it is a guaranteed issue program that can be payroll deducted. Anytime any one of your clients can payroll deduct, and they don't have to write you a check, the opportunity for that business to stay on the books and have the greatest amount of persistency rises exponentially. We find that anytime Americans, especially in this economy today, if they've got to write a check for an insurance program as opposed to their light, their heat, their mortgage, it's going to go to those other services, and those other programs get lapsed, or they just don't buy because they have to write a check. But if it comes out payroll deducted, there's a psychological benefit there that it's not seen. I get a net amount. It's being paid. Somebody else is paying for it. I don't have to write a check, and that is extremely valuable in the marketplace. So those are some of the values, some of the benefits that we look at when we look at this program. And how does this relate to? How does this relate to you and your clients? Well, the positioning is just this. This is the great lead in with your employers. If you have not had a discussion with an employer, said, have you heard about the Class Act? If you have, what have you heard about it? How do you feel about it? Is long-term care a benefit you want to provide for your employees? If it is, I have a solution. Okay. If they haven't heard about it, this is a great opportunity to school them on what is in play, why the government feels that it's so important for individual Americans to have long-term care insurance. You can have the discussion with them about long-term benefits, nursing home care, and the cost of these services long-term, and how they can help position their employees with another benefit. The Act allows you to discuss alternatives for long-term care worksite sales. And again, I go back to the long-term care multi-life program. Because this is a non-ERISA type program, you can differentiate. You can discriminate. You can take the highly compensated and you can give them a program that they can payroll deduct because it's an individual program and it's theirs and it's portable. You can take the rank and file and give them a different format. You can take the rank and file and say they can have a $100 a day benefit with a 90-day elimination period and a 3-year program to get the cost in line for those individuals. You're doing them a great service for the standpoint of, because if you weren't making this position play inside of that employer group or with that individual, they would not have that benefit. And one of the myths is that Medicare and Medicaid will take care of me. That is not true. In the first 100 days, you have your Medicare, which is covering certain items through long-term care. But after those first 100 days, you're pretty much on your own until you exhaust all of your resources, and then you become a ward of the state, and then you get into Medicaid. And at that point, if you are not in a nursing home facility, there's only a few nursing home facilities that will actually take Medicaid patients. And if you've ever had the situation where you've had to take a loved one to look at a facility, especially a Medicaid facility, you'd be appalled at the services that they provide. So with long-term care, with this opportunity, with a daily income benefit, payroll deducted, portable, it gives peace of mind. It gives people a lifestyle that they're comfortable with. It gives them some pride in their older years, because if you did end up with a program where you had a 3-year benefit and they were in a Medicaid facility or a non-Medicaid facility, they can use their long-term care benefits to pay their costs. Once they're there and they run out of money, they can't be kicked out. So that's one of those key components that you want to make sure that your clients are finding the best value and the best services available. You want to be able to protect whatever assets they have. I don't want to get too deep into the partnership program, but a number of the multi-life plans that we have today do conform to individual state partnership programs, and you can talk to your life and long-term care marketing specialist about the partnership program. They're very well schooled in it, in which states have it and which states don't, and they'll be able to help you understand how to position long-term care as a partnership program to protect assets long-term. So this is now not only a benefit to maintain a lifestyle, but it is also an estate planning tool. It is also an asset transition tool as well. So there's multiple benefits to long-term care than just making sure that the nursing home costs are covered. The final positioning is that the plans are flexible and can be carved out for executives of different levels. There's so many different unique features to the programs, and they are complex. But the differentiator here is that you now not only are viewed as an expert, bringing that individual, the Class Act, and making them understand what it's all about, how it's going to work, what the value is, what the benefits are, and then what you can do as an alternative to be more flexible, to give them better benefits, potentially lower costs, potentially higher income, and greater peace of mind. So you have a lot of different opportunities here inside of the Class Act to position yourself as the value expert. And so what's your competitive advantage? Well, your competitive advantage is that you actually have the clients. You have business owners who probably have never even thought about this as a benefit. And remember, this is not something that is going to cost them. It can be a voluntary benefit that the employee chooses to payroll deduct themselves. If the employer wishes to contribute some money, that's totally up to them, but it is nothing other than setting up a meeting for you and these employees, explaining to them the program. If they wish to participate, you set them up on payroll deduction on a list bill, and away you go. The clients trust you. You have business owners who you've worked with for years. They trust you. You are their expert in the field. You are now bringing them a new solution and a new alternative to help them on their business and their their development of their employees. Think about how many new opportunities you've brought to that business owner in the last year. This is a great opportunity for you to get back with those individuals and have a substantive conversation about a whole brand new benefit plan that will help not only the employer but the employees long term. The model is similar to a benefit enrollment process. You're very familiar with that, so it's not really outside the box for how you deal with individual enrollments. Another benefit is that it's fully commissionable on multi-life plans. So multi-life is an individual policy, which is a fully commissionable plan in the program. Group is priced at group, but multi-life is priced as full commission products. So if you end up with an employer group of a half a dozen, you have 4 individuals who have 4 multi-life plans. You have 4 fully commissionable contracts, and you've only talked to one business owner. Payroll deduction. Well, we talked about payroll deduction before, and we know that the benefit of payroll deduction, so you have that in your back pocket. And right now we have 4 different carriers. We work with 9 carriers in total nationally on our long-term care model, but we have 4 different carriers that do multi-life and group and are ready to serve the employee groups that we have out there. One additional competitive advantage that we have, which we didn't add to this, which just came up recently, is that we are partnering with a distribution group who partners with our carriers. So if you end up with a group of 50, 60, 70, or 100 employees, we have a turnkey distribution plan that we can put in place. They can enroll online if the employees want to. We can do individual enrollments and put an individual enrollment specialist on site as well. So you as the agent do not have to do all the enrollments. You can do all of them if you wish. You can do a percentage of them, or you can do none of them, depending upon how you want to schedule the process when you have a case that goes into enrollment process. So that's a 5th competitive advantage, or a 7th competitive advantage that we have that is built into this model for your help. So those are some of the key advantages. Those are some of the key benefits that we have here. I'm taking a look at our chats right now. I'm not seeing anybody who has any questions at this point. I think one of the ones that I'll address right now is the fact that, how do you get started? Well, I think the key here is that Mike Mallon and Tim Haynes, our 2 life and long-term care specialists, are here to help and are ready. They will reach out to every participant on this call, because you all, by attending, will receive another booklet on long-term care, the benefits, the pros, the cons, and we're gonna communicate that to you within the next 24 hours. So Mike and Tim will be reaching out to you, seeing if you have any questions, getting you that next piece in this whole process. You've taken the first step by attending this webinar. You've also added by getting our full kit on the Class Act and long-term care, and you see the value of it because you're on this call. Importantly, these individuals are here to help. We can build individual programs. We can build individual illustrations. We can build group illustrations. We have everything right there at your fingertips. Our in-house underwriting will be able to help walk you through any type of application process and underwriting that needs to be done so that we can get your cases placed and start the commission flow as soon as possible. So our competitive advantage as your partner is I've got 2 marketing specialists on the long-term care side who are willing to help answer questions and do the illustrations once the censuses are in place. We have our back office who's willing to create, scrub, clean, and package those applications and get them to our providers for the fastest turnaround time from an underwriting perspective, and get your cases placed. But again, for the Class Act, remember, the challenges with the Class Act are it's undefined at this point. It is a benefit from the standpoint of it is getting people talking about long-term care. The risk or the concern is it is voluntary and there's no pre-existing condition, and the government is now wanting to also get involved in being a benefits company. And that's always makes me very, very nervous because there's no backstop there. Premiums can vary as wildly as possible depending upon how they want to position the product. and the actual benefits are well below anything that an individual would need to sustain themselves long term. Again, the benefit is we're talking about it. And anytime we're having a discussion about long-term care in the marketplace with Americans, and having that discussion is valuable and prosperous, and you are positioned in the best light possible to bring that discussion to your employer groups. Reach out to us. Tim and Mike will contact you all. If you have any questions, let us know. I see that there are no questions coming through on our chat box today, so this is about 40 minutes. I promise you 35 to 40 minutes we'd wrap this up. Again, slides will be on our website. Our recording will be on the website. I appreciate you taking your time today to listen to the presentation. We wish you all the best for the fourth quarter. Have a great rest of the year, and hopefully some of you we will see next week at our Top Producer Summit here in Boise, Idaho. And if you're going to be out there, please make a point to come up and introduce yourselves to not only myself, Tim, Mike, and our management staff. And again, have a wonderful rest of the week. Have a great fourth quarter, and thanks for participating. Take care. Bye.